Good evening. In this session, we'll be dealing with the embryology class in which we'll discuss briefly about ovarian cycle, menstrual cycle and fertilization. So ovarian cycle, it is the rhythmical changes in ovary from primordial follicle to the formation of the corpus luteum. So duration is 28 days, like it is same like menstrual cycle. So in each ovarian cycle, 5 to 12 follicles undergo maturation, and out of that only one follicle will fully mature and sheds the oocyte. So rest of the follicles become inactive and are converted to interstitial cells. So follicle stimulating hormone from anterior pituitary will help in maturation of the Graafian follicle. The theca interna and stratum granulosum will secrete the estrogen. So these points we have already seen when we are dealing with the gametogenesis. Now you can see here. So this is the, so here we are seeing both cycles. So we are seeing the ovarian cycle here, we are seeing the menstrual cycle. So now we'll discuss in this particular cycle as you see here. So in the first phase, so from the anterior pituitary there is follicle stimulating hormone. So this follicle stimulating hormone, name itself speaks, it will stimulate the follicles for maturation. And on 14th day there will be ovulation. So this ovulation is due to increase in luteinizing hormone LH. So this luteinizing hormone will induce ovulation. So this ovulation, after induction of ovulation, this LH itself will actually try to give feedback and try to reduce the follicle stimulating hormone. Then ultimately what will happen after ovulation, the remaining interstitial cells will form the corpus luteum, which will secrete progesterone and estrogen. So this progesterone will help in maintaining the endometrium in the next half of the menstrual cycle. If there is fertilization, this corpus luteum will become corpus luteum of pregnancy and will continue to secrete progesterone till 4th month until placenta takes over the function. So this is the ovarian cycle. So let us discuss the highlights. So before going to that ovarian cycle proper, you can see here the structure of a mature ovarian follicle we are going to discuss, where there will be a secondary oocyte with first polar body in perivitelline space. You can see here. So this will be the secondary oocyte. And then there will be zona pellucida, cumulus ovaricus, then antrum folliculi. You can see here. Maybe here it is not visible zona pellucida, but you can see the antrum folliculi. You can see the cumulus ovaricus. You can see the cumulus ovaricus, and this will be the discus proligerus. And here you can see the theca interna, you can see the theca externa, and you can see the membrana granulosa. So what is the role of estrogen here? So it helps in development of secondary sex characters. It will help in repair and proliferation of the endometrium before ovulation. That means the first half of the menstrual cycle is taken care by estrogen. It increases the glycogen content of vaginal mucosa, prevents its keratinization. So prior to ovulation, estrogen increases, inhibits follicle stimulating hormone, stimulates luteinizing hormone. Then there is conversion of primary oocyte to secondary oocyte and initiation of ovulation. So now here if you come, the ovulation. So here there is rupture of Graafian follicle, release of the secondary oocyte into the pelvic cavity. Then middle of menstrual cycle is the point where there will be release of oocyte, that is approximately 14 days before onset of menstruation, irrespective of the length of the menstrual cycle. See, 14 days before the onset of next menstruation, there will be release of oocyte. That is, ovulation is taking place 14 days prior to the onset of menstruation. So it has nothing to do with beginning of menstruation. So it is always 14 days prior to the onset of next menstruation where there will be ovulation. So after ovulation, follicle collapses to form the corpus luteum. The corpus luteum has granulosa lutein cells, which are the enlarged stratum granulosum cells. See here. So these are the granulosa cells. So these cells will enlarge and form the granulosa lutein cells. And there will be theca lutein cells, which are the paraluteal cells. They are formed from theca interna. You can see here, this will be the theca interna. So from which theca lutein cells will form. So from the granulosa and from the theca interna, these two cells will contribute for the formation of the corpus luteum. So granulosa lutein cells will secrete progesterone and small amount of estrogen, whereas theca lutein cell will secrete only estrogen. This will be for your next entrance. So progesterone, what is the role of progesterone? So it prepares endometrium, progesterone, progestation. So prepares endometrium, especially the secretory phase of the menstrual cycle, for receiving the fertilized ovum. So this will be predominant in the second half of the ovarian cycle or second half of the menstrual cycle. So it increases the tone and decreases the contraction of uterine musculature to prevent expulsion of the developing embryo. So it decreases FSH release from the anterior pituitary to prevent maturation of follicles for next cycle. So now, what is the relationship here between FSH and LH? FSH will stimulate formation of LH through estrogen, which is secreted by theca interna and stratum granulosum, and LH will inhibit the follicle stimulating hormone through progesterone of corpus luteum, so that further follicles will not mature if there is fertilization. So same thing here, you can observe anterior pituitary, FSH, then growth of the follicles, then ovulation. You can see the LH resulting in ovulation. Then after the ovulation, there is formation of corpus luteum, which secretes progesterone and estrogen. You can see this progesterone, the dotted line, which is negatively inhibiting the follicle stimulating hormone. Okay, even estrogen is also inhibiting the follicle stimulating hormone. So corpus luteum of menstruation, lifespan is 12 to 14 days. 1 centimeter is the maximum diameter. So after 14 days, degenerates and results in decreased levels of progesterone, which initiates menstruation. Finally reduced to fibrous nodule, corpus albicans. Corpus luteum of pregnancy, you can see if there is fertilization, there will be formation of corpus luteum of pregnancy. The trophoblast secretes human gonadotropin, which helps in the growth of the corpus luteum and prolongs its activity up to end of 4th month to secrete progesterone. So this progesterone will inhibit the FSH so that further follicles will not mature. So now coming to the menstrual cycle, average duration is 28 days, but it might vary in different females. So it is defined as periodic structural changes in endometrium of uterus during reproductive life. They include growth, degeneration and exfoliation of the endometrium. Cycle counted from day 1 of current menstruation to the day 1 of next menstruation. So exfoliation of the endometrium, that is menstrual bleeding, which will persist for 3 to 4 days. You can see here. So this is the menstrual phase. So this is the day 1 menstrual phase, 1 to 4 days. Then there will be follicular or proliferative phase. So where estrogen is the main hormone. So on the 14th day after ovulation, the corpus luteum will come. The corpus luteum will secrete progesterone. Progesterone will help in the secretory phase, also called as progestational phase. And again on 28th day, if there is no fertilization, there will be cessation of activity of corpus luteum and there will be decreased level of progesterone, which ultimately leads in menstrual phase, shedding of the endometrium. So you can see the changes. So these are the arteries which are becoming spiral arteries. They are elongating and ultimately the glands are also enlarging here. They are becoming tubular, and ultimately if there is withdrawal of progesterone, they will just rupture and all this endometrium which has grown will shed, resulting in menstruation. You can see the menstrual phase, follicular or proliferative phase, and progestation or secretory phase. So follicular phase, estrogen from maturing ovarian follicles will be the predominant hormone. So proliferative phase, it is where there is repair of endometrium for 4 days, followed by interval phase. 1 to 3 millimeter thickness is the endometrium. So uterine glands increase in length and remain straight. So endometrium will have 3 layers, namely the stratum compactum, which is the superficial layer, then stratum spongiosum, intermediate layer, and stratum basal will be the basal layer. So at the end of follicular phase, ovulation takes place. You can see here at the end of follicular phase, the ovulation takes place. So this is the same thing. So this is the follicular phase. You can see the 3 layers: stratum basal, stratum spongiosum, and stratum compactum. So there is a line here. Only the stratum compactum and stratum spongiosum are taking changes in the cyclical changes of menstrual cycle. Stratum basal is for regeneration. So progestational phase, progesterone and estrogen. So here if you observe, there is a progesterone and estrogen, both are there from corpus luteum. Progesterone and estrogen both are there from corpus luteum. It's also called secretory phase. Endometrial thickness will increase from 5 to 7 millimeters. Then there will be increased amount of tissue fluid, accumulation of secretions within the glands. So they will become dilated and convoluted. There will be sawtooth appearance of the epithelial cells, increase in size of the stromal cells due to accumulation of glycogen and lipid droplets in cytoplasm. So this is called decidual reaction. There will be increase in tortuosity of the spiral arteries. So basal layer does not take part in this cyclical changes. Only the stratum compactum and stratum this spongiosum. These two layers will be taking part in the cyclical changes. Stratum basal will not take place in the cyclical changes. So same thing here, stratum compactum and stratum spongiosum taking part. So you can see there is increase in the thickness of endometrium, 5 to 7 millimeters. It was 1 to 3 millimeters in follicular phase. Now it is 5 to 7 millimeters. You can see the more coiling of the spiral arteries, more tubular glands. So premenstrual phase. So degeneration of corpus luteum, as there is no fertilization, there is decrease in progesterone. Endometrium regression precedes menstrual bleeding. So that's why this particular part is called as premenstrual phase. Then the menstrual phase, spiral arteries more coiled and blood circulation in them reduces. Vasoconstriction of spiral arteries followed by dilatation of the arteries. Blood escapes through damaged capillaries. Shedding of small pieces of endometrium, stratum compactum and stratum spongiosum. Lasts for 3 to 5 days. 50 to 60 ml of blood is lost. Blood does not clot usually due to proteolytic enzymes. So cause is withdrawal of progesterone. So sometimes there might be annular menstruation. So menstruation without ovulation, probably due to withdrawal of the estrogen, no formation of corpus luteum. Then fertilization prolongs the secretory phase, prepares endometrium for implantation. So you can see here. So there is withdrawal. So as there will be stoppage of activity of corpus luteum, if there is no fertilization, then there will be withdrawal of progesterone. Ultimately, it will result in menstrual phase. So fertilization, it is defined as fusion of two mature germ cells, an ovum and a spermatozoon to form a diploid zygote. It takes place in the ampulla of the uterine tube. So in this process, there are three main steps: approximation of gametes, contact and fusion of gametes, and the last one is the effects after fertilization. So in approximation of gametes, it involves transportation of spermatozoa, which is mainly by prostaglandin, which is secreted from semen, and oxytocin from neurohypophysis. Both will induce uterine contraction. So ultimately, out of so many million sperms, only 300 to 500 sperms reach the site of fertilization. So most sperms die within 24 hours. Then transportation of ova, it is mainly by ciliary beads and muscular contraction of the uterine tube. And sometimes there might be transcoelomic migration. You need to understand, that is, ova released from right ovary can be picked up by the left uterine tube. That is due to transcoelomic migration within the pelvic cavity. Then the second part is contact and fusion of gametes. So in this, we need to understand three barriers which has to be passed by the sperm. For sperm to reach oocyte, one will be the corona radiata, the other one will be the zona pellucida, the other one will be the vital membrane of the secondary oocyte. So corona radiata is disintegrated by hyaluronidase secreted by the acrosomal cap of the sperm head. You can see here the three barriers. This will be the corona radiata, and this will be the zona pellucida, and this will be the vital line membrane. This is the perivital line space in which there is the first polar body. You can see this is the nucleus. You can see the centrioles. You can see the deutoplasm. So now there is a term called capacitation, which lasts for 7 hours. This is the final step in the maturation of sperm. So here what happens, the fertilizing and anti-fertilizing. So fertilizing of ovum and anti-fertilizing of spermatosome. There will be an immunological reaction between these two. The seminal plasma proteins and glycoprotein coat are removed by detergent action from plasma membrane overlying the acrosomal region of the sperm. So then there will be acrosome reaction. So head of the spermatosome is formed by nucleus. It is covered successively from inside outside by nuclear envelope, bilaminar acrosomal cap, which is formed from Golgi apparatus, then outer plasma membrane without intervening cytoplasm between them. Then acrosomal cap will have hyaluronidase, acid phosphatase, and proteases, which helps in penetration of oocyte. You can see here, this is the nucleus which is forming the head, and you can see the acrosomal cap, which is formed by Golgi apparatus, and you can see the plasma membrane. So disintegration of first barrier, that is the cumulus supericus and corona radiata. It is by liberation of hyaluronidase from acrosomal cap, which disintegrates the first barrier. So then the second one is zona pellucida. So it's a striated membrane made up of three glycoproteins synthesized by oocyte itself. It has three glycoproteins, ZP1, ZP2 and ZP3. So here with this only the sperm head binds to the ligand mediated by ZP3 receptor protein, induces acrosomal reaction to release acrosin proteolytic enzyme which digests zona around the sperm head. So then sperm enters the perivital line space. Sperm enters the perivital line space. I'll show you in the next diagram. You can see here. So the sperm having contact with the zona pellucida at ZP3 mediated ligand receptor. So then it enters into the perivital line space. So here you can see this spermatozoon has opened up the zona pellucida and trying to enter into the perivital line space. So this is the zona pellucida. So it has been penetrated by this. The ZP3 receptor is helping the penetration here. You can see the nuclear part reaching the perivital line space. From the head of the sperm, the nucleus is entering the perivital line space. Third barrier, vital line membrane. So two disintegrating peptides from the sperm head open the gate. The sperm nucleus enters the oocyte. You can see here the sperm nucleus is entering into the oocyte. It has reached here. So this particular point, this is the pathway through which the sperm nucleus has entered and forming the male pronucleus. So here there are two disintegrants and integrants which are playing the part. Two disintegrants from the sperm head have opened the gate, the nucleus has entered inside, and the integrant from the oocyte will be closing the vital line membrane. So two disintegrant peptides from sperm head open the gate, sperm nucleus enters oocyte cytoplasm, integrant peptide of the vital line membrane closes the gate, calcium wave sets in oocyte cytoplasm. There will be completion of second meiotic division. There will be completion of second meiotic division. You can see here there is second polar body also, completion of second meiotic division with the extrusion of the second polar body. Fusion of cortical granules in the periphery of ooplasm. You can see these are the fusion of cortical granules which are coming here trying to close the vital line membrane. So fusion of cortical granules in the periphery of ooplasm hydrolyzes the ZP3 receptors on zona pellucida and prevents further sperm entry, prevents polyspermy and vital line block due to secretion of cortical granules. Again, so both are preventing the polyspermy. So fusion, male pronucleus and female pronucleus ootids come closer for syngamy. Each pronucleus undergoes DNA replication. So axial fusion does not take place. Chromosomes arrange in equatorial plane of achromatic spindle of the first cleavage division. Single cell diploid zygote with membrane-bound nucleus does not exist here. There is no formation with a single celled nucleus covered by nuclear membrane. Directly there is a division. First cleavage division is taking place and the chromosomes of male and female pronuclei, they will replicate and they will align at the equatorial plane for the first cleavage division. There is no formation of a single cell zygote. So effects of fertilization, it is completion of the second meiotic division of the female gamete as I have shown earlier. Then there will be restriction of diploid number of chromosomes in the zygote because of DNA replication. Then determination of chromosomal sex. So father decides the chromosomal sex of the offspring because X and Y. So if X gamete of the father joins with the X gamete of the mother, there will be resulting female. And if Y gamete of the father joins with the X gamete of the mother, then it will be resulting male XY. So that's why the father decides the chromosomal sex of the offspring. Then initiation of the cleavage division of the zygote. You can see here. So fusion of male and female pronuclei. You can see already second polar body has formed. First cleavage division has completed. A, B, C, D. So fusion of male and female pronuclei. Then centrioles of the spermatozoa migrate to the opposite poles of the nucleus of the zygote. So here you can see centrioles are migrating to the opposite poles. Then the nuclear membrane disappears. So here still nuclear membrane is there, that will disappear. Then the chromosomes of zygote are arranged at the equator of the achromatic spindle during metaphase of the first cleavage division. You can see the chromosomes arranged at the equatorial region. So then there is first cleavage division is complete and two blastomeres are formed with zona pellucida. So now You can also have a note on a special term called parthenogenesis, that is a partial or complete development of an embryo by cleavage division of the female gamete without participation of male gamete. So it is seen in few invertebrates and lower vertebrates. Then what are the applied aspects of this thing? So one is the contraception. So in this we have medications which are used to prevent pregnancy from occurring. So to prevent fertilization. So and there are intrauterine devices also which will prevent fertilization. And there is certain procedures called sterilization, which is vasectomy in case of males and which is tubectomy or tubal ligation in case of females. And there is infertility, that is even after successful completion of 2 to 3 years of married life, if the couple does not have children, so then we treat them as infertility cases and we are going to evaluate them. So for them, if there is any defect in the normal structure or function, we'll go with assisted reproductive technology. So where there is in vitro fertilization of human gametes, or sometimes we can go with intracytoplasmic sperm injection, or we can also go with gamete intrafallopian transfer and zygote intrafallopian transfer. So we can explain this when we meet directly. Okay, name itself speaks. So gametes are transferred to the intrafallopian within the fallopian tube. That's why it is called as GIFT, gamete intrafallopian transfer, or it is called ZIFT, that is zygote intrafallopian transfer. That is, fertilization has been completed. Now zygote is being transferred to the fallopian tube. Thank you.